Okay, here we go. Herpes. So I'm sure we've all heard about it. Herpes simplex virus. So there's two types, HSV-1 and HSV-2. HSV-1 is the herpes simplex you get on your lips. Those are your cold sores. HSV-2 are genital herpes. In the past, we were thinking there were two different viruses, that HSV-1 wouldn't affect the genitals. Unfortunately, we're seeing huge outbreaks. For the last 5 years, definitely been seeing a lot of patients coming in, a lot of women coming in with genital herpes, and we swab them, and they come back as being HSV-1. Well, HSV-1, about 2/3 of the population, 67% of people under 50 have been exposed and have had HSV-1. And probably about 12% have had HSV-2. How do you get it? You get it from oral sex, basically. That's how it happens. And if your partner has a cold sore that's active and they're performing oral sex, you can pass on HSV-1 into the genital area. It's very painful, blisters, fevers, some swollen lymph nodes. The good news is that area is not the normal host for the herpes. So you'll maybe have one or two bad outbreaks, and hopefully it stops after that. HSV-2, you can get it for the rest of your life, which is very upsetting. Now, there are treatments. There's no cure, but there are treatments. So, what is the treatment? Antivirals. It's a virus, so we treat with antivirals. There's no cure, but you can certainly treat the outbreak. Start your treatment within 48 to 72 hours. You want to be on the Valtrex or on whatever antiviral that you prescribe. If you're getting recurrent outbreaks and it's something that's kind of obviously upsetting your sex life, upsetting your daily life because of the discomfort, you can go on a daily preventer. So you can take an antiviral on a daily basis, and that there can keep it at bay. So the next question is, when do I tell my partner, my new sexual partner? And that's a conversation we have a lot in the office. Is this a first date conversation? I think, the answer to that is, when you think that your situation is becoming more serious, you're deciding this person to be your sexual partner, it's definitely the time to have that conversation. So, unfortunately, that's herpes.